All right, hi, my name is Travis Lindsay. I'm a professor of entrepreneurship and a co-founder of an investment fund called Titan Angels. And I'm here today with Daniel Zakowski. Actually, as a member of Titan Angels, we did invest in his company, Ready Set Food. Daniel, do you remember when that was? Was that a couple of years ago now?
Gosh, it's about 2 years ago now.
It's been about
Anything
2 years.
COVID is hard to understand or remember, but yeah, it was about 2 years ago.
Yeah, I think we have to change to how we date things pre-COVID and after COVID or something like that. So,
Exactly.
Daniel, why don't you introduce yourself to everyone?
So yeah, I'm Daniel Zakowski. I'm a serial entrepreneur. My first go around in starting businesses was selling consumable dental supplies to dentists for about a decade. Then did a number of kind of internal consulting, strategic planning, career type options before starting Ready Set Food to help save babies from getting food allergies.
Very cool. And so now tell us a little bit more. Besides, so saving babies, obviously, that's a good thing, right? So what is Ready Set Food, and why did you start that business?
So it's a great question. I started Ready Set Food almost 4 years ago now, also pre-COVID, so it's a little
Wow.
bit hard to remember sometimes. But
Yeah.
really, after my nephew developed a number of severe food allergies, he's 4 years old now and can't go anywhere without an EpiPen because he has anaphylactic reactions, that one of which I've seen, to peanut, egg, dairy, tree nuts, sesame, and he developed those allergies around 7 months of age. And we'd seen, my brother-in-law, who's a doctor, had seen multiple clinical trials that had been published in a year or two before that, showing that you could prevent up to 80% of those severe food allergies from developing in the first place, just by giving babies small amounts of allergenic foods early and frequently. So for example, the first clinical trial gave small amounts of peanut powder 3 times a week for the course of 4 years, and found that prevented 81% of severe peanut allergies from developing at all. And it was stunning to us that my nephew now has lifelong, life-threatening food allergies, and not 100% can be prevented, but 80% can be prevented, not by a drug or a chemical or an injection, but just by feeding babies small amounts of those allergenic foods starting from a much younger age. And it's a big educational hurdle, but that wouldn't have created a business. I think what really created the business is when we were looking at the different clinical trials and trying to understand how these were done. We saw that even in the clinical trials, with parents who signed up for the clinical trial, they had a really tough time getting their baby to eat these foods. And in the biggest clinical trial, you had only 43% of parents who were able to complete the clinical trial in the way that it was intended, because their baby just weren't good enough eaters at 4 months of age when it's the right time to start. And that they also saw that the 57% that weren't able to complete didn't have any benefit of preventing food allergies. So that even if everyone had the perfect knowledge of exactly how to prevent food allergies, if we want every baby in the US to follow the protocol from those clinical trials, they needed help. And if we wanted every baby not to develop the allergies my nephew has, they needed help. And just to put some hard numbers on that, if every parent in the US followed the protocol from those clinical trials, there'd be over 200,000 babies every single year that don't develop food allergies as a consequence. So we really tried to figure out, like, what's the best way to help make it easy for babies to eat these allergens. And that's, I think, when we came upon a business around it. So we have a patent now on introducing allergens to babies by feeding it to them through a bottle. So we created a powder of the most allergenic foods, peanut, egg, and milk, and did it in a way that it can help it dissolve more easily in a bottle of breast milk or formula. And also it's small enough particles that it won't get stuck in the nipple of the baby bottle. So it's just real food. There's, again, no chemicals or additives or drugs or anything like that. But it's a method that allows parents to, as easily as possible, follow those clinical trials. And we've seen now 3 years in that, comparing to the clinical trials that had a 43% compliance rate, our product has over 90% compliance rate. And that's without all the help of doctors and nurses and people who signed up for a clinical trial because they were so passionate about it. So I think we've seen that Ready Set Food is just a much easier way to follow the new medical guidelines on how to give your baby the best chance at not developing food allergies.
Yeah, and this is something that the passion about it, you found this real problem. I'm just going to make a short little comment here, but yesterday I was discussing with my students who are primarily non-business majors about building out a business plan. And one of the ways to come up with a concept or an idea is to do something that you're passionate about. Find something that you see that's going wrong in your day-to-day life, and then start building a solution about that, and then build that into a business. And that sounds like exactly what you did, because your nephew, suffering from life-threatening food allergies, that's a big issue. And so you developed this solution that you've been working on now for 4 years, and you've made a hell of a lot of progress on it from everything I've seen. So
Yeah,
good for
thank you.
you.
And thank you so much. And we really appreciate your support from early on. People who believed in what we were doing in our mission is important. And I couldn't agree more that it's so important to have a mission that you as a founder believe in. I think that, running a business of any size can be hard and challenging and has lots of roller coasters of up and downs, COVID being not necessarily the least of them. But that having not only a business that you believe in from a profit and fundamental financial perspective, but also a company whose mission you believe in. And not every mission has to be preventing food allergies. There's missions about making people's lives easier in a lot of different ways. But I think having that belief that you're really doing something good helps bring you through tougher times.
Yeah, absolutely. It helps you develop that grit that you need really to get through. And speaking of that, last year, the pandemic, it destroyed a lot of businesses. A lot of businesses had to shut down. But your revenue, I think you're saying it was up 3x over 2019. How the heck did you guys do that?
I think that is a combination of luck and skill, like I think many other things in business, but in this area also like a heavy bit on the luck side. So I think that we were lucky that we'd closed a funding round a month before the pandemic hit. So we didn't need to be quite as worried about, well, we need to be conscious about cash conservation, but there was not the imminent concern of running out of money right away, and allowed us to really think about what the right way to approach the pandemic was. I think that the other part that we were quite lucky in is that we hadn't launched in retail yet. So we were still primarily online, and there's been plenty of challenges even selling products online. USPS is delivering more slowly and causing people to miss their shipments. There's all sorts of, people can't go to see their pediatrician as easily. So if they have questions about food allergy prevention, it's harder for them to ask. So there's definitely been challenges, but I think we've been much luckier than people who have in-person businesses, whether it's something like hospitality or entertainment. I was just talking yesterday with someone who had a company around clubs and promoters and making that a better system, and there's no clubs right now. So it's like I think that to some extent we were a little bit lucky, and then also having gone through a business that we I think made the wrong decisions about how to handle the Great Recession in 2008 2009. I think I just had a fundamentally more conservative approach to how we should grow this business, because I think that a lot of startups have this idea that if they're not, growing like a hockey stick, then someone else will be able to overtake them. And I think that from our perspective, there are certain times when that's necessary, but that especially when there's a big uncertain thing coming in your direction, that there's only one reason that businesses go out of money and that grow out of business, and that's running out of money. So that if you can make sure that you're acting in a way that's conservative relative to, especially relative to such uncertainty, that was the other thing. And then the last is that if you're conservative and cautious, and also are lucky enough to have not have immediate cash flow problems, which we were, then you can also really focus on the areas that you think won't be as much of a problem. So for example, we'd been planning last March to launch a system-wide healthcare system partnership with one of the largest healthcare systems in the country. And we ended up launching it eventually, but it took 9 months because of COVID. So we ended up pivoting from that being a core part of our 2020 strategy to really focusing a lot more on direct to consumer, on how we use the internet, how we use influencers, how we use the kinds of things we could do. It meant we couldn't do photo shoots, we couldn't do video shoots, we couldn't do healthcare partnerships. But I think just being realistic and not too optimistic about what can and can't be done in the circumstances of a pandemic, combined with being cautious of cash conservation, I think again, a large part of that is luck. If we hadn't closed our round right before, or if we were primarily an in-person business, I think it would have been really a lot more challenging, and we would not have seen 3x growth. But that combination of the right decisions with some luck on financing, and also on the marketing channels we were using, allowed us to have a really great year last year.
Yeah, I mean, speaking to that, I know that I've seen studies that show that founders who try to say or figure out how their business failed, undercapitalization was always like one of the bigger reasons. And so, yeah, the pandemic was an obvious cause of this one, but in the future, that's going to happen again. Maybe not a pandemic, but every business is going to face hard times. And for those businesses that maybe have a lot of short-term debt, or they're just kind of working on a month-to-month basis, I mean, it doesn't really enable them to weather any of those down times. So, and I know it's hard. And I know like local businesses, restaurants, the companies at strip malls, the mom and pop stores, that they're kind of working on a month-to-month basis. But the best advice that I can give on that front is try to save up as much as you possibly can, because you never know. You never know. I mean, there may be another pandemic again like this in 50 years. Maybe it's, you know, a couple hundred years. We don't know. But there's always going to be tough times. So saving up, building up some cash reserves is always a good thing. And then
Yeah.
also, I mean, what you've done is diversify a little bit your revenue streams, and so I think that that's also helpful. So if something falls, I mean, if, like, let's say you were in retail, I mean, you also have subscription, you also have online sales, and there's other ways for you to make money. So
Yeah.
diversification, and I know that that's probably going to be tough for a lot of businesses to do, but that's kind of how you have to survive, right? Because you never know.
Absolutely. And I always think back to this book that I really like called Anti-Fragility. And there's a lot of interesting
Oh,
concepts in it,
Taleb,
but
yeah,
yeah.
yeah,
And just thinking about how, like, if you're operating at peak efficiency, pushing everything to the max, then you're also not equipped to handle problems that happen. And as a startup, I think you always want to push as hard as you can and squeeze every ounce of efficiency out of everything that you're doing. But to some extent, if you're doing that to the fullest extent, then you're not well equipped to handle changes because you're over invested in every single thing that you're doing.
yeah. I mean, so you're right, absolutely. Businesses, they're a lot of the times focused on efficiency, developing those, but I think really, like, especially for a startup, the focus should be more on growth. Maybe not like that hockey stick kind of growth that you were talking about, but that's one of the ways to survive. I think, but one of the better ways to survive. You can work on efficiency later, but that should never really be like the primary concern, especially early on, or if you're a small business. Uh,
Yeah, and I think the one analogy I've heard that from one of our advisors that I thought was really helpful is that, especially in the early days, what's going to determine success or not success is less about the exact percentage of growth that you have or the exact percentage margin you have, but more that there's a number of different questions that you have to uncover during the course of your exploration in the startup that will determine whether you have an opportunity to succeed or not. Like for us, there was a real question: would we get a patent? Yes or no? Would we get people to stick by our product for a number of months? Yes or no? And I think by thinking creatively about, like, what are the things that will really unlock value both for us and also for investors, and then how do we find the most clever ways to kind of turn those cards over and see what lies on the other side. And that's really helped us unlock value without spending as much money, I think, in a lot of areas.
Very good. And if you just had, like, if you were pressed, to give like one or two sentences, like what other piece of advice, or what would be the biggest thing, the biggest piece of, or the most important piece of advice that you would give to other business owners right now trying to tough it out during these times?
So I think that it goes back to one of my favorite books, not to always reference a book, but I think there's a really great book called Strategic Intuition by William Dugan from Columbia University. And it applies generally, but I think especially in times of change. And a lot of what he talks about is how some of the best and most innovative ideas don't necessarily come from people who are experts in a certain area. They come from looking outside of your area of expertise and looking at what other companies and other industries are doing and learning from the best of them. He talks about how Google's PageRank was really based on a combination of what the way books were sorted in libraries and things that you wouldn't think of as like areas to really drive serious tech innovation, but that by looking at not just best practices, but at really cool, innovative ways that other businesses, other categories are doing things, that I think gives you opportunities to really be innovative in your category because those things haven't been tried where you are. And I think especially in COVID, there's a lot of companies that are really struggling, but there's a lot of companies that are succeeding. And I think you can try and look at the companies that are succeeding and seeing what's really driving that level of success for them, despite what's going on now. Is it because they're more diversified online? Is it because they're meeting some unique other customer need that they didn't really realize before, but that other categories are doing a good job at? And I think that especially in times of big change, looking across the board, not just within your niche, but really at everyone and seeing who's making this work for them and what are they doing that I could learn and bring back to my business, even if it seems like it might not apply. I think that's been a really valuable way to look at the world for me in general, but also especially with COVID. And I think it also gives a great opportunity just to when you meet new people, learn what's interesting and valuable to them that you can then bring back to your business, even if they're a doctor or a lawyer or in some other totally random line of business. Like, what have they done to do differently in this pandemic and to do better? and that even if it seems like it's just such a different business, it might not have learnings. I would say that just means you're probably not being open-minded enough about what you can learn from other people, and that's really what I think has driven a lot of our ability to find interesting ways of doing things, is looking not necessarily at like what the experts in our category were doing, or what we thought when we sat in a room with 4 people and came up with great ideas. That those are also good things to do, but that I think some of the most uniquely innovative ideas come from what other people have already been doing for 20 years in a different industry.
Yeah. And you have the benefit of looking and seeing what is successful in other industries. So
Exactly.
that, I mean, there's at least some evidence there that it works on some level. So why not use it with you or in your business? Yeah,
Exactly.
It makes total sense. Look out for the best practices and then apply it to what you're doing, and then just keep on growing. Yeah, and I think that also that focus on growth. Again, it's not necessarily we need to grow 10x every year or anything like that, even though you did 3x last year. But we only have so much time to work every given year. We only have so many dollars to invest in the business. All those resources should be applied to doing things that have the highest ROI possible. And focusing on efficiency or some of the other stuff, probably does have a positive ROI, but not necessarily as high as you need. So make sure that you're actually focusing on the right things. Moving forward a little bit. So coming up February 18th, I believe that is, what day of the week is that?
Thursday.
That's a Thursday. Okay. So February 18th, you are hosting a panel discussion, and I'm going to read it because it is a somewhat long title. You might need to work on that a little bit, but it's called Innovations and New Guidelines in Pediatric Food Allergies and Food Allergy Prevention. And that's not so bad. It's an important title. It's an important topic. Tell us a little bit about that.
Yes, and it definitely could be a little bit less wordy, but it's mostly for the healthcare systems and payers. So they're used to really jumbled and wordy slides.
It makes total sense. That's really a short title then.
Exactly. So for us, I think one of the things that was really exciting last year is we did well as a company ourselves, I think, but that there's also a number of like larger market forces that were really moving in our direction. And one of the biggest ones is that the American Academy of Allergy, Asthma, and Immunology, which is the most important allergy medical association in the US, created new guidelines for prevention of food allergies. And it's not different than what we've been talking about for years based on the clinical trials that I was mentioning in the beginning, but that now having medical guidelines really crystallize those insights into recommendations is going to be a really big part of how we grow and build awareness on this topic. So, one of the recommendations for parents is that every parent feed their baby peanut and egg, especially, but all allergens starting at 4 months of age, which is exactly what we've been saying is the learning from the clinical trials, but it's good to hear that from a real medical guideline. And that the other is that they say that healthcare providers should implement educational programs so they're doing a better job educating their patients. Because there was a recent survey that only 30% of pediatricians were even talking about food allergy prevention. And I would also note that was on a self-reported basis, so the real number is probably substantially lower. And that one of the things we're really excited about this year is helping build awareness both among healthcare providers that they should be talking about this, and that it's also with these new medical guidelines, there's a really clear, easy way to explain it. Because you don't need to explain the clinical studies to patients or go into a depth as far as risk categories and things like that. There's just a clear recommendation for all babies to eat all allergens early and often, and that'll be a great way to help a lot of babies, but also help make our job a lot easier so we don't have to do as much education and can just focus on why we have an amazing product that makes it easy as possible. And that the other part of those guidelines talk about how there's really good ROI for insurance companies and payers to invest in food allergy prevention. So they document in that published paper $13,000 savings for every baby with eczema that does early allergen introduction, as this process is called. And this is what we've been talking about for a while, but in the past, you could have had to read through the clinical studies and then do some math, and now having it, again, crystallized in a way that's really easy for both providers and payers to understand why there's real benefit for them to get involved in the food allergy prevention fight. I think that's a really exciting thing for us because as a small business, it's challenging building awareness across the country for food allergy prevention, which parents also have a lot of questions about. So having a better option to engage healthcare systems and payers is really exciting, because we did eventually launch that system-wide educational program I mentioned earlier with Advocate Aurora that has 36,000 babies every year. But if we want to really scale that up across all healthcare systems nationally, these guidelines are the perfect way to help do that. So that's why we're really excited about this panel. And we have the head of allergy from Children's Hospital of Philadelphia, the former president of the American Academy of Pediatrics, and a professor of pediatrics from Northwestern, talking about, even less about ready, safe food, more about why every health system and payer should seriously look at the new guidelines, what they say, and why they should engage with companies like us or on their own to really drive awareness in a way that will, I think, benefit us too.
Yeah, and I think this was, correct me if I'm wrong, but in our early discussions together when we were considering investing in Ready Set Food, I mean, this was one of the discussions is that how are you actually going to get the word out? Because getting this sort of regimen on government guidelines or just in pediatrician office, I mean, that's a huge uphill battle. And it's something that a lot of entrepreneurs, especially when they're creating something that is pretty much new, because I don't think there was, I mean, there was some competition a little bit maybe beforehand, but not really. So how do you do that? And I mean, so like this event that you're talking about on February 18th, that's part of it. And I'm sure we could have, hours long discussion about this, and it would be really valuable. But yeah, I mean, one of the things that a lot of entrepreneurs have to do is that education piece of it, and it's not necessarily the easiest thing.
Yeah, and I think just linking back to the prior part, I think just look at what we were talking about before, that the way we ended up being successful there is not being too stuck to one route of doing it. Initially we tried talking with pediatricians. That wasn't a good route because they just had too much to change in their office. But being open and seeing how other people had really done this, we saw opportunities to lobby for new USDA dietary guidelines, which were published finally in December after we lobbied for almost a year about them. And then, we're also the combination of luck and skill. We also were lucky enough that the major medical associations came out with their guidelines. But if we hadn't been plugged into the right people, we wouldn't have known that was happening, and we wouldn't have been prepared to take advantage of it. So I think just always thinking creatively about like, what's going to work? Is it going to be healthcare systems up with COVID? We have to pivot off that onto something else. And I think that one of the biggest challenges that we've had, and that I think all entrepreneurs are going to have, is how much do you keep pushing against something that's not working yet? Because it takes that kind of grit. And when do you say, okay, now it's time to move on to something else? And I don't have a great answer for that, but I think that's a constant battle of like, how do you decide like when to keep pushing and when to pivot?
Yeah, and something you hit on there is like trying to find those levers of power, the kind of the nodes in the chain that really help determine, what the narrative is going to be or what people are going to say. There's this book, maybe you've read it. It's by Ryan Holiday called "Trust Me, I'm Lying." And basically, what that book says, part of it, anyways, is that if you want to try to get a story placed in the New York Times or the Washington Post or Wall Street Journal, you don't go directly to the reporters there. What you do is you find out where they get their information from and kind of work down the chain and start getting your stories placed in those smaller places, probably like a blog, maybe even a Reddit forum or what have you. And then eventually it'll start trickling up and get to the big guys. And so, I mean, it's sort of like that, just in reverse for you. And I think that's a really cool way to do things. All right, Daniel, thank you very much. Where can people go to find out more about you and Ready Set Food?
So the best place is readysetfood.com, just like Ready Set Go, but with food at the end. Readysetfood.com. Also, our product's sold on Amazon. And I think the other part, which is I think an interesting example of one of these kind of unique strategies we've used, is we've created also brand agnostic education sites like preventallergies.org, which is something that these healthcare systems feel comfortable linking to. So any parent can go learn about the topic on preventallergies.org, but that for our product itself, readysetfood.com is where you should go.
Perfect. Well, thank you very much, sir. I'm sure we'll be in touch, and have a good one.
Thank you. You too, Travis. Thank you.
All right.